Good afternoon and welcome back to GP Video Podcast by Nadia. Today we will be talking about underdiagnosis of type 2 diabetes mellitus. Before delving into the topic of underdiagnosis, we should know what is type 2 diabetes mellitus. So type 2 diabetes mellitus is a condition in which the body becomes resistant to the normal effects of insulin and gradually loses the capacity to produce enough insulin from the pancreas. Now, what is insulin? This is the hormone that is secreted by pancreas to control the blood sugar levels in the body, to reduce the blood sugar levels in the body, to transfer the blood sugars from the blood into the different parts and cells of the body. This condition has a strong genetic and family related, so non-modifiable risk factors, and is also associated with modifiable risk factors like obesity, like diet, like exercise, physical activity, and all. So type 2 diabetes mellitus is associated with two types of risk factors. One type of risk factors, you cannot do anything about it because if it's in your family, if it's in your genes, if you have the family connection, then you cannot do much about it. But what you can do much about is your diet, your exercise, your physical activity, and keeping your weight under control. We do not know the exact genetic causes of type 2 diabetes, but it does have a strong genetic and family related causes. Okay, so how is it diagnosed? It is diagnosed on the routine blood test when blood glucose levels are high due to insulin produced by the pancreas not working effectively and or the cells of the body not responding to insulin effectively, known as insulin resistance. So what happens is, when you go for a blood test, there are a couple of blood tests that can be done. One is the fasting blood sugar levels. The other one is called HbA1c, which is a hemoglobin, type of hemoglobin that shows the blood glucose control over the past 12 months. There is another test that I usually do with my patients who are prone to develop type 2 diabetes, which is called serum insulin levels. What is serum insulin levels? So what happens is in type 2 diabetes, the serum insulin levels are usually high because what happens is that the body is producing enough insulin. It's not like the body is not producing enough insulin as happens in type 1 diabetes, but what happens is that the body itself, the cells are resistant to the pancreas, the insulin produced by the pancreas. So what happens is pancreas actually, first it increases the production of insulin because it thinks that maybe the insulin concentration is low in the body. That's why the blood sugar levels are not being controlled. So the signal goes to the brain to ask the pancreas to produce more insulin. But that's not the case. That's the insulin resistance in the body, the cells not being able to, respond to insulin, or the insulin that is being produced is not working effectively. That's why blood sugar levels are not going down. So there comes a stage, like chronically, there comes a stage when the pancreas also, reduces producing insulin, and that's when the type 2 diabetics will require insulin injections. But that's a long stage. But in the first stage, this is the first difference between type 1 diabetes and type 2 diabetes. In type 1 diabetes, pancreas does not produce enough insulin, while in type 2 diabetes, there is a lot of insulin, but the body is not responding efficiently or effectively to insulin. So when you do serum insulin levels in the people who are prone to get type 2 diabetics or who are type 2 diabetics, they have very high or moderately high or mildly high, basically anything above 10 to 15 in the insulin levels is more than 15. So anything more than 10 is mildly high, 10 to 15 is mildly high, and more than 15 is moderately high, and then these people are at risk of developing diabetes. So then what are the other facts about, so it is diagnosed when blood glucose levels are high due to insulin produced by the pancreas not working effectively and the cells of the body not responding to insulin effectively, known as insulin resistance. Over time, the condition progresses and the pancreas does not produce enough insulin, and then type 2 diabetics also become insulin dependent. So it usually develops in adults over the age of 45 years, but it's increasingly occurring in younger age groups, including children, adolescents, and young adults. Because there was this misnomer again that in younger adults or children, it's type 1 diabetes, and in older adults, it is type 2 diabetes. That's not the case anymore. There is an increased risk of developing type 2 diabetes, and there are more and more cases of under 40 developing type 2 diabetes. And actually, according to a fact, there are more under the age of 40 now with type 2 diabetes than type 1 diabetes. So again, it's a very alarming situation, and we'll come back to this topic tomorrow because it's very, very important.